Oz Plus today, exhaustion and fatigue. Now, earlier on his show, Dr. Oz talked about these conditions and how they can wreak havoc in your life. And a good night's sleep, by the way, may not help. You may still feel tired all the time, and that's a problem. You just can't snap out of it.
A lot of people complaining of that. Joining us now is one of Dr. Oz's guest experts from his show today, Dr. Susan Blum, a preventative medicine and chronic disease specialist. Thanks for being here, Dr. Blum.
Have you here.
Well, thank you so much for having me.
Sure.
You know, I find your approach to medicine fascinating. How's it different if I came to you versus my internist, for example?
Okay, so I practice functional medicine, and this is a medical specialty that focuses on the prevention and treatment of chronic disease. And we do that by getting to the root cause of the problem and not just treating the symptoms.
You talked about exhaustion today with Dr. Oz. I know that's a big problem as far as nutrition and how that's a role. What other factors make us tired? What is it?
Yes, well, actually, I've created a fatigue checklist that I use with my patients, and there are 5 foundational systems that need to be really healthy in order for you to feel energetic. So the first thing is food, and we did cover that before, but what we didn't cover was the need to not eat too much sugar, because riding the sugar wave all day could make you really tired. The second thing is deep nutritional deficiencies that are inside your cells, so your little furnace doesn't work so well, and so we take a look at that. The other thing is hormone balance, and it's really all your hormones, so it's not just the thyroid, which I talked about on the Dr. Oz show.
Isn't it? Yeah.
It's really really important, and this includes the cortisol, the stress hormone, in addition to your sex hormones, which are really important as well. And the other 2 on my checklist are toxins. You know, we use a lot in the news about environmental toxins, and we have really wonderful ways to evaluate the toxic burden that people might have that might be making them tired. And finally, some people do have chronic infections, and so we look at that as well.
That's very fascinating.
It is. You know, how about sleep? Because everybody says, well, you know, if I get enough sleep, it'll just wash it all away. That's the answer. But that's not really true, is it?
Well, you know, a lot of people do have sleep problems, actually. And so I do a lot of work helping people get a better night's sleep. And so, you know, the minimum is about 7 hours. 7 to 9 is really what you want to aim for. So once I get you sleeping, then we can see if that fixes the problem. And a lot of times it doesn't. And so we do need to go through the checklist to really look at all those other systems to make sure if they're working.
How about attitude, you know, and just feeling positive about life? And stress and all those problems. Try to find a way to, you know, cure that.
Well, you know, actually attitude goes a long way, and a lot of really happy people don't even realize how much their stress hormones might be making them sick. The stress hormone cortisol, if you walk around with very high levels of it, it can actually suppress your thyroid hormones and make you feel very tired. So it is really important to find time every day to relax and turn those stress hormones off. Okay, and it doesn't have to be meditation. You know, people get very nervous about meditation. Oh, I can't do that, right?
Yeah, but you can, though.
But you can, but you can also do things like knitting and painting and going for a walk in the park, and all those things will help turn you into that off switch, which is really critical to balance all of your hormones.
All right, I'm going to start with a big, deep breath. Dr. Blum, thank you so much.
You're very
Great advice.
Thank you for having me.
Chill out.
Just breathe. All right, thank you.